name is Liz Waltman, the Outreach, Education, and Communications Coordinator for the Southeastern Atlantic region. Before we begin with today's guest speakers, there are just a few administrative details I'm going to go over with you. As you are sharing, communicating, and asking questions in the chat box, please be sure to send to all attendees. This is a drop-down menu in your chat panel so that I, our guest presenter, and your colleagues can see your questions and information shared. So I will be collecting questions that come in throughout the session, and then we will have time at the end for those to be answered along with any other questions that may come up. If you need closed captioning for today's webinar, I'm going to post a link to that in the chat box now. So today we are thrilled to welcome two guest speakers. Allison Monpetit is the Director of Nursing Research and Innovation at Virginia Commonwealth University Health and a board-certified registered nurse in nursing professional development. Her primary role is to support a nurse-driven culture of clinical inquiry in evidence-based practice and research at the VCU Medical Center. She is the chair of the Nursing Research and Evidence-Based Practice Leadership Council, a collaborative council composed of clinical nurses, health system leaders, and faculty from the VCU School of Nursing. Allison supports the VCU Health Nurse Residency and the Nursing Interns and Scholars programs, working closely with program, faculty, and clinical nurses. In a secondary role, she oversees VCU Medical Center's Fourth Magnet designation. So our second presenter, Roy Brown, is a research and education librarian at the Tompkins McCall Library for the Health Sciences at Virginia Commonwealth University. He serves as liaison to the nurses of VCU Health and the VCU School of Nursing. As part of this work, Roy serves on VCU Health and School of Nursing evidence-based practice and research committees. He also supports the VCU Health Nurse Residency and the Nursing Interns and Scholars programs by working closely with administrators overseeing the program as well as with participants. Roy has presented on his work with these groups, including successful EBP tools and strategies he utilizes at the American Nurse Credentialing Center Magnet Conference, the ANCC Pathways to Excellence Conference, and other state and regional nursing conferences. And just before I turn this over to Roy and Allison, they have created a great resource guide for their presentation, and on this you'll find links and resources they'll be talking about, but also the full slides of their presentations. So I will put that in the chat box now if you would like to access it throughout the session. And with that, I'm going to pass the presenting power to Roy and Allison.
I don't know if you know what you're doing, Liz. You don't want to do that. Good afternoon. We're happy to speak with you today. I'm sorry my introduction was a little long. I should shorten it up for Liz. That was a lot of reading. But we're happy to talk with you today, and we have a couple of objectives for this short amount of time that we have with you. Our first objective is to talk about the importance of translation, which I think as librarians will be pretty obvious to you. And in talking about that, we'll discuss the importance of translating research to practice and reviewing nursing's role in translation through evidence-based practice. As you all know, if you work with nurses or are about to work with nurses, the nursing approach to evidence is somewhat different than a doctor's approach, and so we'll talk about that. We'll also talk about magnet recognition, what that exactly is and what it all entails. And as you can see here, we'll review the magnet model briefly, and we'll talk about how the program works and how it facilitates translation of research to practice, which is a big part of it in empowering nursing practice. We'll also talk about the characteristics of a magnet organization and how that all works, and what the organizational culture exactly looks like, in hopes of helping you as a librarian identify ways that you can get involved. And then lastly, and this will be the part where I play a major role, I guess, is partnerships with medical librarians. What is it that we can do as medical librarians in a magnet organization to really show return on investment for having librarians, and what we can do to help set ourselves not only up for success, but the people that we work with. To just give you an idea of who we are here at VCU, There's the VCU Libraries and there's VCU Health. VCU Libraries is a part of the academic institution of the university. VCU Health is a totally separate thing. It sits on its own, but they work together. And in fact, the hospital sits right up the hill from me. VCU Health is a 779-bed urban medical center, which I know will be a little bit different if you work in a community hospital. That's a huge jump. It's a 3-time designated magnet facility with 11,000 employees, with over 3,500 of those being nurses. One of the interesting things that sets VCU Health apart is not only is it a 3-time designated magnet facility, it also has 11, we think there's actually more than this now, 11 plus Beacon Award units within the hospital, which is a unit designated mark of distinction, and it's the most in not only the country but in the world. It's an international award, and VCU Health is pretty fortunate that we have really good work going on here that allows us to have so many of those designations. VCU Libraries, on the other hand, is a part of a 2-library system here with James Branch Cabell Library on the academic campus, and where I work at Tompkins McCall Library, a mile away, on the medical campus. There's 7 liaison librarians here. As you can see, we cover all the various disciplines. For myself, I not only have the nursing folks in the School of Nursing, I also have them in the hospital, and because of that, I'm pretty active as it pertains to the magnet journey, because in magnet, one of the things that has to happen is there has to be a close collaboration between the School of Nursing and the hospital, and so as a result, I kind of play a bridge between the two. And that gets us to our first objective or point here, which is the importance of translation. I think this will be pretty clear to you as a librarian to understand what the point of information is and its importance, but how it's translated is also key.
Hi everybody, it's Allison. So I'm going to jump in and just talk about a little bit of how magnet designation is important in translation. But to set the stage, really, to make sure we're all on the same page, talk about that imperative that we have, which is to narrow the research to practice gap. I was formerly on the academic side in a faculty role, and from an academic side, you're really looking to generate new evidence. You're looking to fill gaps in the literature, and on the clinical side, we're really looking to take that practice to our patients. We're always looking for opportunities to improve our patient outcomes, and what can we do best that's, the best evidence for our patients. Unfortunately, as a system, we haven't done a great job, and it's been lots of ranges in reports as far as how long it takes evidence to move from research to clinical practice. But one of the common figures you'll see is it takes 17 years. And I think what Magnet is really trying to do on top of excellence in nursing is really approaching as a way to narrow that gap. And so one of the National Academy goals is for us to have 90% of decisions be based on evidence by 2020, which is quite, it takes my breath away, because we know that a lot of the work that we do may not have a solid evidence base to support it. So from a Magnet standpoint, where we're looking at research as well as evidence-based practice, I think Magnet is really trying to move the mark here. And there's actually some evidence to potentially say that in Magnet organizations, we may be better at translation, and you can see that in slide 3.
Yeah, and as you can see, there's about 8, and what's kind of shocking is 2020 is right around the corner, and at least according to one study, and there's several studies I've seen a range of like 18 to 25%, where our decisions are not necessarily based on evidence the way they should, which is a key role that librarians can play. Which brings us to talking about healthcare today and why it is that the Magnet model is so important in empowering nurses. And a lot of that goes back to, nursing and nurses are having to make a big transition. You all probably see it, especially if you work with schools of nursing, you're especially seeing it because there's a real focus on this. But they're going from having, doing everything based on your opinion or finding a colleague and using their suggestions and past experiences to having to move to science, research, and evidence in order to make a decision. That's a huge leap for many people, and especially nurses who've worked for a while. Sometimes they have a hard time thinking, you want me to get into PubMed and you want me to look at all this evidence? There's a lot of words here, and I don't always understand what's going on or what it's exactly saying. And so that's kind of a key thing to kind of think about, is that we're having really a paradigm shift when it comes to this. That paradigm shift is largely driven not just by nurses wanting to improve patient care, but legislation and payers are really moving that forward too. The Affordable Care Act is expanding access to health insurance and therefore health care, which means all hands have to be on board, which means that nurses are having to take a larger role, especially a nurse practitioner. And a part of that is using evidence, and also not only using evidence to give the best care, but also to reduce costs, which is also another big driver of Medicare and Medicaid. You know, they're into not only reducing your costs, but they're also looking at indicators like patient satisfaction and readmissions and length of stay as to how much they're willing to reimburse you. And so, you know, as you're thinking about these things as a nurse and as librarians are thinking about where they get involved, a lot of the solutions are based upon the best evidence. I know our chief nursing officer here, she's very into, yeah, let's change practice, let's challenge things. But in the next breath, the next thing she'll ask you is, what's the evidence say? And if you don't have the evidence, she really can't go to bat for you the way she would like to. Then lastly, you'll see the private payers or insurance companies. You know, a lot of the reimbursements have to be based on an evidence base of some sort. They just won't let you do things just because you've always done them. They're looking for reasons to you know, I hate to say save money, but they need to make sure that what you're doing is based upon sound evidence. And that lastly brings us to, as we're talking about this to kind of set the stage, is many people have heard of the triple aim, and there's also now a quadruple aim through IHI. What this is just another way of looking at healthcare. You can see that the triple aim was very, very focused on patient-centered care and cost and population health. In other words, keeping people out. What you're starting to see in the transformation, and you're seeing this a lot in the nursing literature, and it's showing up in the structure of magnet organizations, is not only are you having to look at that, but you're also having to look at care team well-being. I'm sure that if you work with nurses at all, you've heard about mindfulness and you know, taking moments out and finding other ways of doing things to take care of themselves, because if the care provider can't take care of themselves and they're in a bad state, they're not able to provide quality care to patients.
And I think one thing to add, especially in the quadruple aim, is it's the care team, and we work not in silos. We work in healthcare teams, and I've always seen nursing, and maybe it's because I am a nurse, but the nurses are at the patient's bedside. They are there with them 24/7, and so they're really in a perfect place to advocate for patients and see the systems issues, you know, right there in that unit. And so when we think about what's driving us, we've got to function better as teams. We have interdisciplinary policies and procedures, interdisciplinary care plans, and so working across the team is really important. And so care of team well-being, yes, is at an individual resilience, reducing burnout, etc., but it's also about fostering team-based care, teamwork, if you will. Just a few things about nursing. We are the largest group of healthcare providers. This past year, the theme for Week of the Nurse was 4 million reasons to celebrate. So there is estimates of approximately 4 million nurses in the United States. What can be a little bit confusing for folks looking into the nursing profession from an outside view is that a nurse is not just a nurse. There are so many levels and different types of certifications and specialties. You know, the neighbor down the street's asking me about, you know, they're pregnant, and I'm like, well, I'm not a labor and delivery nurse, so, you know, I only took care of patients that were trying to die because I've worked in critical care. But what I want to talk about, like in the next slide, is about those different levels and how they play together. But, you know, we go from a registered nurse to a nurse practitioner, midwives, There's all sorts of levels of higher education from PhD to DNP. The DNP is the Doctorate of Nursing Practice. It's the practice doctorate. It's equivalent to the MD. And they're practicing in all settings, where it's acute care, inpatient, it's ambulatories, and community settings. But what I think is really great about nursing and working with nurses is that they really have a systems view. They see across the unit of how to make things better for all patients. And then the prevention focus is also, we want to prevent things from happening, which is a little bit different from a medical model that's looking at how do I apply the best evidence for this patient right now, or how do I treat the disease here. It goes from a disease focus into a treatment focus, whereas we're really focused on preventing. And I think one of our challenges is really, at this time, trying to link all professional levels of nurses to engage for that goal of narrowing that research to practice gap. Is there anything you wanted to add?
No, I'm good.
Okay, we can go on to the next one then. So this is just a visual schematic that I have found helpful in trying to talk to nurses that are thinking about going for an advanced degree, or trying to conceptualize what is the difference in a PhD and a DNP prepared nurse, and how does this relevant to me at the bedside. So if you start at the top left with the PhD expertise, again, we're all familiar, PhDs, construct research studies. They are really into knowledge development. And creating those studies, with which a DNP, their expertise is in that knowledge utilization, being able to synthesize all of those research studies, think about the context of their institution, and really work to create evidence-based practice and evidence-based guidelines that could then be implemented at the bedside. The clinical nurse specialist, which is that CNS, along with clinical nurses at the point of care, which could be, as our Chief Nursing Officer Deb Zimmerman likes to remind us, it's not just bedside nurses. It's at the chairside, tableside, or the bedside. It depends, because we're working everywhere. But those nurses and nurse practitioners that are at the point of care, they're at that practice piece. They're the ones translating this knowledge to our patients. So when you think about them, they're more engaged in performance improvement and quality improvement initiatives, which is continually ongoing to try and improve practice at the bedside. So we all work together in different ways, but hopefully this will help you get a sense of how we all connect, or should connect, or could connect.
Mm-hmm. And that brings us to this. We've kind of set the stage as to where healthcare is today and why it is that we have Magnet. And now we're going to briefly talk about what magnet recognition is. But the major focus of magnet recognition, recognizing organizations empowering nursing practice. And if we're empowering nursing practice, it's really a way to empower librarians to become largely, or have a larger role in what goes on, because they need evidence in order to drive their practice. And one of the people who's best positioned to do that is a medical librarian.
So, magnet, where did it come from? This is a recognition that comes from the American Nurses Association and the American Nurses Credentialing Center. The ANA is an enterprise now with multiple arms, and the recognition program is just one of those elements. So how it started, the little bit of the history, and there's a reference that's in the handout, they call it the 14 Forces of Magnet. And what they were looking for in 1983, or actually before that, it was the ANA study, is they were worried about the nursing shortage at the time. Because again, we're the largest healthcare provider, we have an aging population, we need to make sure that we've got people to care for the aging. And so they did a comparison looking at organizations that retained the nurses and compared it to organizations that seemed to have a higher turnover rate. And what they found were that there were these 14 elements that were common to organizations that were able to retain their nurses. So nurses are very visual and image driven, so that's where magnet came from. It's what was magnetizing, what was keeping them there, what was attracting them there, and so that's where magnet came from. And so since those 14 forces, and we'll talk about that in a little bit, the magnet model has been evolving over time, and it went from as something for the United States into now an international program where we have almost 500 recognized organizations according to their website. And their website's got, you know, the ANCC Magnet Recognition Program has a lot of information that you can go back on if you're curious about the background. But magnet recognition is not an easy process. It's a very rigorous application and review, and you get a 4-year designation, and it really takes about a year to reapply to get all of the elements, and you'll probably see why. Now, for organizations that aren't magnet yet or want to be, but they want to do what's called the Pathways to Excellence program. So that's a program, a lot of people refer to it as mini magnet, which is, you know, it's another way to think about it. It's a way to look at your organization, see that you're on the pathway. Maybe you don't want to go through the full rigor of a magnet application. And like in the intro, VCU Medical Center is in the process of the 4-3 designation. I'm overseeing the writing of the magnet document or the magnet application. And it has been, coming from an academic training background, it has been one of the most wonderful, enlightening opportunities for me in my career and in this role to really get a, in-depth understanding of magnet. So we get asked a lot, why is magnet recognition important? And we can go to the...
This is the 14th portion.
But what we're going to see in one of the slides coming forward is, you know, why...
You mean go
No, that's
forward?
perfect. That's perfect. This is just for your reference if you're interested in those original 14 forces. Some of the feedback on the newer model is that it seems too simple, and this seems very clear in what are those forces that they're looking for. So this is just for your reference with the original citation. But why is magnet recognition important? And it's really because you wonder, are these organizations just going to be that way? Do you have to go through the magnet recognition process in order to be have a magnet environment? Because what they're saying with a magnet recognition is that you have organizational nursing excellence, and you have an empowered nursing workforce that can take clinical issues and escalate them and drive practice changes. And because of that empowered nursing workforce, you have better patient outcomes, you have better organizational quality and safety, you have lower costs because you've reduced length of stay of patients because you're applying best evidence, you have lower turnover in the nursing workforce, and you have better nursing recruitment and retention. It's estimated that it takes about $80,000 to orient a new nurse. And so if we have turnover, if people are leaving at the 1-year mark, 2-year mark, you know, that's costly for organizations. In our organization, we have over 3,000 nurses, so it's a huge workforce. On the Magnet website, you'll see this library of Magnet journal articles, which pull the references about why the impact of magnet's important. So you have for folks looking at what is the benefit of magnet recognition. But again, it's an assessment of the culture. But what I can say from the reaccreditation process, because we believe VCU Medical Center is 100% magnet. So why would we need to be reaccredited if the environment is what it is, right? Like, why would you do it? And I can say that by writing the reaccreditation document, it asks that you take a hard look at all of these specific standards, and it has given us almost like a flashlight to shine the light on some certain areas where we, you know what, we say we're shared governance, but maybe that needs to be, you know, tweaked a little. So it's really, it's almost like a self-assessment tool for you to really take a look. And so that's what I would say the magnet recognition and the reaccreditation process has really done for us. So this is the magnet model on the left, where you have structural empowerment. And if you look to the table on the right, you can see what those original 14 forces of magnet, what it means. You have exemplary professional practice, you have transformational leaders, and you have new knowledge, innovations, and improvements. And it's all about impacting empirical outcomes. That's those patient outcomes, that you've improved patient outcomes, you've improved workforce outcomes. We have very specific requirements as far as how is it making a difference. Sure, it's great that you have leaders. Show me the money, like show me the evidence that they've made an impact on patient care. I added the section of organizational overview because when in a Magnet document and in a Magnet application, you've got to talk about your organization. And there are specific elements to the organizational overview. They're looking for policies. They're looking for, do you have policies and programs in place to support team member resilience? Again, that's part of that quadruple aim. Again, you can reference this to get some more information, but it's important to know that the Magnet is looked at in a systematic way across the organization. So you'll hear people talk about Magnet Standards of Excellence, or SOEs. Now, with each of those components, there are specific things that you have to speak to. So this is just a very brief, not formal definition of each of them, of each of the components. So, you know, transformational leadership is about empowered leaders, ensuring that the voice of the clinical nurse is heard at all levels. Structural empowerment means that we have a structure that empowers our nurses to escalate their voice, to share in the decision-making process, to establish standards of practice, to be promoted in their own professional development. Do we have the structure that empowers our nurses?
And what you'll notice from a medical librarian standpoint is you can play a role in a lot of these places, but where I find myself playing a role, and where I know a lot of other people do, especially in new knowledge and innovation and improvements, which is all evidence-based, but you also can play a role when it comes to the empirical outcomes part. A lot of times nurses will come to me with issues or problems, and one of the things that they have to have is data. Like, what is that data telling you? Is this really a problem, or is it just something you think is a problem? And so one of the other roles I see medical librarians being able to play is not generating data or you know, doing that when it comes to empirical outcomes, but they sure can play a good role when it comes to linking things together, you know, saying, hey, you need some data, this is the person you might want to talk to. And in some cases, you may be the person that's the connecting agent, because you may be the person who has the relationship with that person to be able to reach out and pick up the phone and have that phone actually answered, which is, you know, one of those things to say. I mean, we are in a pretty large organization here, and not everyone knows each other. But I have a role, I think, in just about all these others in various ways. I know that leadership a lot of times will be looking for articles to improve themselves, and I've actually even set up search alerts that deal with those, with the various leadership topics, from retention to how to become a better manager, that have been very informative for people. So you can have your fingers in all these, and some of them you're more active than others.
So before we move along, one of the major areas in evidence-based practice is threaded throughout this. So, but one of the strongest areas, strongest elements is going to be in the new knowledge, innovations, and improvement section. So there's a lot. I mean, we actually have written a whole exemplar about Roy and how he's facilitated and helped with a performance improvement project. So he's very well highlighted in the Magnet document. The other thing about a Magnet standard, when you talk about empowerment and leadership and practice, one of the things that is new this year, because we have new standards that are out that we have to speak to, is they've asked to look at the RN engagement scores and surveys. So every year we survey the entire nursing at all levels. And if we don't outperform in certain areas, meaning our data shows the voice of the nurse is saying, I'm not empowered, then you can't even apply to Magnet. So they've taken a very strong stance that this is, if your workforce is not saying they're empowered, it doesn't matter how many examples you give them of excellent work. What it comes down to is the nurse's voice heard? So, it may be a little hard to get your head around about what is a magnet exemplar, what is a standard of excellence. So just as a brief overview, in a magnet application, we have to describe nursing practice in writing through approximately 90 standards. So that's a lot. It has taken, we are about 90% done with our magnet document, and we've been working on this for over a year of getting those stories. And of those 90 standards, we have to define and speak to approximately 69 standards of excellence, which requests a specific example based on their standard definition. And the kicker is, each standard is unique, and it has some mix of clinical nurse, escalation, communication with leadership. It's very layered. You have to pay for the magnet application manual, so I didn't want to give you a specific one, but I will read a couple of them to you from the New Knowledge, Innovations, and Improvement section. So, for example, this is a standard of excellence that we have to write an exemplar about. So we have to provide one example with supporting evidence of a clinical nurse's implementation of an evidence-based practice that is new to the organization. On the flip side, we could say we have to provide an example with supporting evidence of a clinical nurse's use of evidence-based practice to revise an existing practice within the organization. So those are just two examples of standards, and again, 69 of them are unique. They have different requirements, and so you have to provide meeting minutes to prove that this is what happened. You have to provide the literature. You have to provide data. If it's an empirical outcome or an EO, you have to show that it moved the data metric in a table format showing a trend line. So this is not an easy process.
No, it's not.
Quite rigorous. So this just shows the model and overlays how many standards you have to speak to in each of the categories. So 21 in structural empowerment, we have to give 22 examples of exemplary practice, 11 in new knowledge, innovations, and improvement, 15 in transformational leadership, and then we have 10 that we speak to in organizational overview. And what I will say is that with our magnet, the exemplars that we've chosen, even if it doesn't say evidence-based practice in the standard requirement, there is so many opportunities where we actually incorporate the use of evidence to drive a process change. So a large percentage of this focus on research, evidence-based practice, or performance improvement. So anytime you say EBP, to me, is an opportunity for a medical librarian to connect. One other takeaway from this is that research is just as important. Filling that practice gap with new knowledge is just as important. To be able to apply for magnet, you have to have a minimum of 2 completed and 1 ongoing nurse-driven research studies. And what's new to this 2019 manual is that they must be employed by the hospital. So in the past, being part of a large academic medical center, as a health system, we could claim the research that was conducted by our adjoining school of nursing. But now it has to be, the clinical nurse has to be in the health system somehow. We do have a couple of faculty that have joint appointments. They work PRN on a unit, and we can claim those studies. But this is really for a lot of smaller organizations that don't have the resources associated with an academic medical center may struggle to have those nurse-driven research studies. But I'm convinced that every clinical nurse thinks more in a research mindset. They have ideas, they have workarounds, innovations, that really empowering them to do research is really important as well.
And sometimes they just need a cheerleader. That's what I've found. That's one of the roles I play, is cheerleader. I may not be able to help you with the research, but I can connect them and play a cheerleader, because sometimes everyone just needs some encouragement. Now that brings us to, we've talked about what the magnet program is and what it is when it comes to, you know, what magnet recognition means. Now, how is that translated? She talked about how much fun she's having with this document that she's having to write. It's like a tomb of information. But what you'll see is in the characteristics of a magnet organization, in that empowerment piece, there are a lot of different places that you can find as a librarian, depending upon your skills and background, could really be a right place for partnership to show your value, and therefore, if you're in a hospital setting, maybe not have your library threatened to be closed down, which is an unfortunate result of people not valuing what librarians are doing. But this is one way to be dispersed throughout the organization and doing work is through a magnet organization.
So one of the ways within our system, remember we are looking for structures that empower, and evidence-based practice is a power tool, in my mind, a way of utilizing evidence-based practice to promote positive change in an organization. Elements of evidence-based practice is seen throughout the organization. In our professional practice model, we speak about a pillar of knowledge. It's in our shared governance structure. Our shared governance makes decisions based on evidence. We use a nurse residency program or a transition to practice program that teaches them how to evaluate evidence, and that's one place where Roy is significantly valuable. Within our own professional advancement, or a clinical ladder is what we call it, to advance to different higher levels and to get promoted with a pay raise, you have to speak to your contributions to research, performance improvement, or evidence-based practice. So it's seen throughout in multiple ways. And then another way is the fact that we do have a partnership and library resources. And I've been to some organizations where they say, we can't even search literature. And that's a huge message from the organization saying you can't support evidence-based practice if you're not supporting getting best evidence. But more than anything, it's exactly what Roy said earlier. Our chief nursing officer, every leader in our organization, and even nurses say, we got a problem, all right, well, what does the evidence say?
And that's the biggest part of this. And that's even with performance improvement. I think one of the other things to think about that's not necessarily on this slide is that one of the things about Magnet is they're also looking for nurses to be in an interdisciplinary role where they are partnering with people of other disciplines. And so if you're thinking about how you can show your value, yes, you can show it with nursing, but in those interdisciplinary roles, you're also going to be touching medicine, occupational therapists, and others who may also need evidence. So therefore, what you're seeing is your influence is dispersed throughout. So you'll have a lot of people who can speak up and advocate for you if for some reason money is short, because nothing that can be done in healthcare today can be done without evidence. And so that's kind of a key thing to kind of think about.
This slide about various evidence-based practice models is really for your reference. The takeaway here is that organizations typically subscribe to a specific model to support evidence-based practice in the organization, and this is one way that you can figure out what language with which you need to communicate to nurses. So this is more for your reference than anything, and some organizations grow their own model, but these are some of the established ones in the literature that they're more common.
Yeah. With this one being one of the examples of the system-wide piece. If you all see this is the ARC model. This is one that came out of Ohio State in the work of Bernadette Melnick and some others, and it kind of shows you, the Hopkins model and the Iowa model are a lot about process, and this is about how you set it up organizationally. So, if you need another way to look at it, as I said, this is another way of a reference to do that. That's kind of a big deal.
So if your organization that you're working with doesn't really subscribe to a model, this is a great one and a great place to start, because it gives you organizational assessments that you can do to evaluate their readiness for an evidence-based practice, and it can also follow up on the outcomes and implementations. This is a great reference.
And if you want an example of how this has worked and where you can show value as a medical librarian, here at VCU, because every magnet organization has to have some sort of EBP model, the one that we've adopted here is the Hopkins model, a lot because we really like the tools that come with it, which make evidence-based practice very easy to digest at the bedside. Well, one of the things I did to help with that process and to kind of really insert myself into things is I noticed through education and working with folks that there wasn't a total understanding of where research started, where evidence-based practice was, and what was PI. I have a lot of people who confuse performance improvement or quality improvement with evidence-based practice. So one of the things I did to kind of enhance the Hopkins model here and to improve our education so that everyone's speaking from the same place, so that it improves interdisciplinary care and communication, is I designed an inquiry process diagram, which is a link to in the handout, that largely leads you through the process, which is another way of kind of conceptualizing and seeing, you know, for me, what it did for me is I conceptualized this. I also was able to identify where I could provide services or where I could leverage some of my partners here at the library and as well as at the university to kind of improve things at the hospital, which has helped me to further become integrated into what's going on in the hospital.
Yep. And I can't say enough about how much this map, if you will, has helped folks get an understanding of where they are. Evidence-based practice, getting into the literature, figuring out what am I going to do, how am I bringing this to the bedside, can get very disorienting. And so, again, showing how all the evidence, appraising evidence is the critical foundation step before research PI or QI or EBP. So it's standard, it's the one tool, and that's where nurse residency is focused, and that's where our EBP interns and scholars program is focused, is helping people get good literature, because they need to learn that you have to show all of the literature, not just bias your search to the outcome that you think would be correct. So getting nurses the appropriate skill set is so critical, and this has just given them a lot of comfort and ease in understanding where they are in the process. So this has been a phenomenal resource. And
not only do they need to be able to find it, they also need to be, the key to this is also appraising the evidence, and which kind of slides nicely into the last section we're talking about, which is partnerships with medical librarians. As a librarian, you have a lot of skill as it pertains to information literacy, and if you've taken any classes and things in research methods and whatnot, what you'll see is that you are pretty naturally aligned to help with appraisal, as well as several other things that are going on.
So, you know, we spoke about this before, about the places where medical librarians connect, and it truly is. It is a partnership between nursing and medical librarians in order to be able to get quality evidence and to make sure the process with which they're getting the evidence is solid.
Yeah, and because if you want to think about it, and I don't think none of these are game-changing things I do, and I think that that's the first thing I want to say. But for you who may be having issues trying to integrate into a magnet organization, or even if you are working at a hospital that is not a magnet organization, and you are doing this for informational purposes, there's all kinds of ways for you to get involved. The biggest thing I do, of course, is the standard thing that everyone does, which is I assist with finding evidence and doing the literature searches for people. Part of that also goes back to refining the question. I find a lot of nurses struggle with having a good question and identifying internal data sources to support their question, because what I tell people as I instruct them is there's no dumb question, because you're asking questions because there's a gap in your knowledge. But at the same time, that doesn't mean every question is going to be valid for you to carry forward. You've got to have data to support that this is a problem, because if you go to the chief nursing officer or you go to your nurse manager or somebody who's making a decision, they're going to have to delegate resources to that. And if you're not giving them data to support that this is a real problem that they ought to pay attention to, and furthermore, you're not aligning it with hospital goals, that can be a real problem. I also find my natural partner, other than Allison, is the Nursing Education and Professional Development Department. They're the ones who are identifying education. They're the ones who do all the CE courses. And so I do a lot of assisting with designing classes that address various aspects of EBP, not just how do you search the literature, but I also help teach the classes that deal with appraisal and, you know, of course, question development, which I think is such an integral part of this. I also, and this is a new thing for me, is I'm also getting more and more involved in assisting with dissemination of nursing projects. And what I mean by that is helping with giving them insight on how to write a good abstract, how to create a sound poster that will, you know, communicate what you want and lays out well and is attention-getting, as well as helping them identify where to write and where to submit abstracts. I think all of that is huge, and it's one of these new avenues that I've gotten into, because what I'm finding in my organization, and I'm sure it's going to be in yours too, is that nursing and nurses are focused on their patients, and therefore they sometimes have tunnel vision, and they don't always think that some significant project that's given them really good results is worthy of being disseminated. And so, you know, I play cheerleader while also trying to help and identify other resources for them to use, such as Allison, who is a PhD trained nurse, so she's fine at you know, she's fine at getting understanding how the publication process works. But all of that has been really huge in making inroads. And of course, you can always, upon invitation, of course, serve on various councils or attend various meetings that go on in the hospital. I think those are key places, one, to be seen, and also to be able to offer just-in-time information. You know, like the Nursing Leadership Forum is a once-in-a-month meeting that we have here. It's all the nurse managers. So the who's who of making decisions are there, and I usually either sit right in the front, or when I really don't want a whole lot of work, I'll sit in the back. But most of the time I sit in the front, where I have audience with not only the Chief Nursing Officer, but some of the other people who make decisions, and I'm able to show my value that way, as well as being involved with these other committees and councils. The last thing I tend to do, and I think this is probably the role I underplay, is I'm also a connecting agent for people and resources. Because I get involved in so many projects, and I'm sure this is going on at your institutions too, is you understand what's going on in the hospital in a way that most people do not. And so when things come to you, you're a natural person to help be the connector between the various entities within your hospital in order to make things better. Because the one thing that you don't want in a hospital or any organization is a duplication of effort. And so, you know, if somebody's working on an EDP project that is very similar to what's going on in another unit, you as a librarian can really be the person to say, hey, if you know, North 8 and North 5 are working on the same project, you could be the person that brings those two together. One, to improve the project because more people are involved, and therefore, you know, it disperses some of the work. But it's also a way to kind of, you know, stop the duplication of effort that goes on. Because I'm sure if you ever work with nurse residents, I'm sure you see falls, nurse retention, you see all the same questions, and you're like, why is this happening all the time? I mean, yeah, it improves your skills at searching on specific questions, but it's sure not moving things forward.
And I would just like to say, he really does live that mission. I get constant text messages saying, hey, I need to connect this person to so-and-so. How do I get in touch with them? Or because it truly is, in our nurse residency program, for the lit search, we would highly recommend connecting with Roy to do your lit search. Now it is officially the Roy requirement. We say, you know, if you're doing a lit search, you must go talk to Roy Brown. And it's really true, and he's really helped to connect. We just recently brought in organizational level clinical nurse specialists to really look at those, exactly what he's saying, those issues that are popping up in multiple units that need an organizational focus. So it's a beautiful connection.
Yeah, and to kind of wrap this up, if you're thinking about how you can get started or you want to further what you're doing, what I have found is that there are various partnerships that are really good that lead to lots of ripe opportunities for advancement. Like I do a lot of stuff where I try to get myself in front of nurse administration and leadership, because they're the ones who have control of the purse strings, so to speak. So, you know, if I'm able to get and show value with them, you know, they're able to kind of disseminate the word down to other people. Like I have a close relationship with our Chief Nursing Officer, as well as many of the department or division nursing directors, because they're all looking to improve practice in their units, and they're all held responsible for that by the Chief Nursing Officer, who's always asking, what's the evidence for this? What's the better way of doing this? And so that's a huge part. As you can see today, I also am involved with the Magnet Coordinator or Magnet Program Director. You may have it called something different where you are. The person in charge of Magnet, it's really important to be with them because, you know, they need you too. And so as a result, if I don't have enough work to do, I just call Allison and she can usually find me something to do along with her crew who are writing the document. The nurse residency program is another key place I think that's pretty important. Like here, we have 4 cohorts a year, and so there's new nurses coming through all the time who are required to do some sort of evidence-based or evidence-supported project, whether it be an evidence-supported PI project or a true EVP project. And in that, not only do I get to work with the new nurse graduates, but I also get to work with the resident facilitators who are the more experienced nurses, and so I'm even able to leverage even more outreach because I'm starting to get more and more into that. And as I talked about before, Education Professional Development Department is a huge place to go. Nurse educators are already spread thin, and they're teaching all these classes. If they can find someone to take one who's confident, they're more than happy to pass it off. So if you're bored, they're more than happy to take up your time. At least I have found that here and in other places where I've talked with people. And in wrapping this up, just kind of keep in mind, magnet organizations are evidence and outcomes focused, and medical librarians can play a key role in that by identifying partners in the organization and leveraging those partnerships to become more integrated into what's going on in the hospital. One of the key ways to do that is that librarians can show value by showing initiative and being present, but in being present, make sure that you're adding something to the conversation. Like every time I'm at Nursing Leadership Forum and they bring up a topic, if it's a topic, whether it's nurse retention, or I know the big thing here, and I'm sure this is everywhere, is patient throughput. I come up with search alerts that deal with throughput, and I push those articles out to the decision makers who need that. And the big part of this, and this is the way to wrap this up, is being involved in the EVP research and PI programs in the organization are a huge way to show return on investment, because when it comes to evidence-based practice and performance improvement and things, money is attached. So any change in practice that saves money is a way for you to say, hey, I was involved in that. You can see my involvement was key to you saving this money. That shows you my value. And you know, that link to quality and safety data outcomes is truly a key to this as well.
And if anyone's a little nervous about reaching out to people you don't know, I'll say that nurses aren't great at asking for help, but they will take it all day long. They're also, as a rule, not great with email either. So just keep emailing them, because again, you know, they're focused on clinical patients, you know, and that sort of focus. So, you know, getting a face-to-face, showing up to meetings, you know, connecting that way, no one's going to say, no, I don't want your help, because the partnership with Roy has been so wonderful for our organization. I can't imagine anyone saying no.
Well, hey, one of the best places I've found to get business, go hang out in the cafeteria. Because they're always cruising through the cafeteria, and if they see you, they'll usually have something to say. And that concludes our presentation. We appreciate your you know, attentiveness, and we're more than happy to ask you know, answer any questions. So I'm giving it back to you, Liz.
Yeah, it looks like we only had one question come through, and it was for Roy. And they ask, so where do you get training from your work?
So I'm pretty fortunate in that I have some pretty forward-thinking administrators where I work here at VCU who've invested in me getting training. Like one of the things that I've done is I've taken evidence-based practice or evidence-based medicine classes at, I took the one that used to be at Dartmouth for librarians, but now is at, I think it's in Denver somewhere. I've also taken numerous, anytime there's a CE or some sort of class that I can take, even if it's not library focused, I usually will take advantage of it. Like you'd be amazed at how much training you could get just through the offerings if you're at a big institution from the hospital itself. Like I've gone through the Lean Six Sigma training. I've attended Quality Academy class sessions, which are dealing with quality improvement and PI. It's just over time I have been able to use my professional development money to identify various places to get training. The other thing I've done, other than do a ton of reading, is you'd be amazed at how much you can learn from the nurses and that you make partners with by just asking. So that's not even training. That's mainly just me learning through conversation. I hope that answers your question. But what I've done is I've went out and mindfully identified places where I can find opportunities to do that. Carol, we have the slides, and I think that Liz can send you out a link to that stuff.
Yes, I will be sending the slides and the resource guide in a follow-up email soon. So we had 2 more questions. Any tips for a librarian headed to the Magnet Conference?
Well,
prepare yourself.
Yeah, so I will be there, actually. I actually presented last year in a room of about 1,100 people. The Magnet Conference is going to, so if you've been to MLA, that's baby stuff compared to what Magnet is. Magnet's going to be really, really overwhelming. I think that the key thing I can tell you is to pick sessions that you think you'll be able to bring something back to the institution with. But I think the most valuable thing you'll be able to do is engage nurses from other organizations about what goes on where they're at, as well as, I think this is probably the most valuable thing, I've been like 5 or 6 times, is you pick up a lot from the nurses that you are there with in like an informal basis that I think is huge. I think the biggest thing I can say about preparing for the Magnet Conference is there's not a real great, until you go, there's nothing else I can say about what that's like. It is a huge conference. It's a lot of fun. But if I had to suggest anything, I would pick strategically what sessions you want to go to, and be sure you're there for those sessions, because they're really, really good, and the nurses are really friendly. Do you want to read these to me, Liz? I don't want to like steal your thunder.
Yeah, I can keep reading them to you.
Sorry, I'm not.
So is there a way to access the Magnet SOE online, or would we go to our Magnet coordinator for a copy?
Yeah, it is not available online. You have to pay a significant amount of money for a Magnet manual. So yes, absolutely reach out to your organization's Magnet program director. Their MPDs, they call them. Usually the Magnet designated title is Magnet Program Director or Research Lead. In most organizations, you're going to have those 2 contacts. They should at least have the manual for you so that you can reference it.
All right, we have another question for Roy. How often do you follow up with your partners? And if so, what is the best method of communication for you?
You know, it depends on who the partner is and what I'm doing. I probably talk to Allison several times a week because she's my primary contact for things. But other people, I try to check in at least every couple weeks with people, and it just depends on the person, whether that's an email. Like a lot of times I like to follow up with, like I know we have a administrator here who's very into the throughput. Like that's what he's been tasked with. And so I'll check in with him, but I especially try to check in with him and attach something useful, so he doesn't just go, oh, Roy's emailing me, I can attend to this later. He actually has to read the email because he knows what I'm attaching may be potentially useful to him. So I don't have a solid answer as to say I check in with people like every 2 weeks or anything like that. It mainly deals with, it's project specific, or like in the case of Allison, because her and I are joined at the hip with so many things, I check in with her on a regular basis, but it largely depends on the project.
And meetings are a great form
to
check in.
Yeah, the meetings where everybody goes to is huge too. Oh, so I can answer this one about the reporting, who I report to. This is, Michelle, this is going to sound really crazy, but I am actually not attached to the hospital at all. Like, I do not work for the hospital. I actually work for the university, and our liaison model is unique in that we have a partnership because VCU Health is part of VCU, but it's independent. That what has happened is they bought out part of my time, so I have some dedicated time with the health system, but I don't report to anyone in the hospital. Which is in some ways an advantage because I'm Switzerland. No matter what goes on, I don't have anything to do with that, so I'm kind of a neutral party when things come up. My positioning in the org chart is largely determined by the chief nursing officer and nursing administration who call me in. I'm kind of an at-will employee, actually. I'm pretty fortunate in that they do invest money in me for my time, and they're also the ones who choose to send me to Magnet even though I'm not an employee. Any other questions, Liz? I don't mind, if they want to stay for a minute or two, I don't mind answering them.
I think there was one last one, and that was, what other conferences might you suggest for a nursing librarian outside of MLA?
That's a really good question. So my approach has always been, I don't get a ton from conferences, really. I mean, I get something from Magnet because I go with colleagues I work with, so I pick up things from that, and there's some really good sessions there. I've been to the Pathways to Excellence conference, which is Baby Magnet, and it was kind of interesting. But I spend most of my time, if I'm going to spend money that's outside of going to MLA or say our regional meeting, I tend to spend it trying to find a meaningful professional development opportunity to take advantage of, whether that's a systematic review course to an EBM or EBP course. That's where I tend to spend my money. So I'm not really well versed on what conferences may or may not be useful because I don't tend to attend a lot of conferences.
One other conference that might be of interest, depending on your organization, is the American Association of Critical Care Nurses. They're the ones that support that Beacon Award for the unit level, and they have a conference called the National Teaching Institute, or AACN-NTI. It's a huge conference. And what I can say from the science standpoint, critical care nursing is doing some really cool things. That might be a good one as well.
But the thing about the nursing conferences is they are expensive. I mean, they're not like going to the medical library conferences. They are a pretty penny, and so, I mean, that's where the showing the value to make a partnership with the hospital, at least pay some of it if you have professional development money, is going to be important. How are we doing, Liz? Are we good?
Yeah, I think that was all our questions, and anyone can also email me if they have any questions that come up, and I can get them to Roy.
And that's not a problem, or I don't know if I put my email on there directly, but if you want to share that with them, I am more than happy to answer any questions. Talk to people on the phone. I know there's a couple people in the room that I have actually talked to on the phone about my activities here, and so I'm happy to do that. If there's something I can do to help you, I'm sure at some point somebody can help me.
So I'm going to take the power back from you, Roy. We have
Awesome.
just 2 more quick slides, just a little more housekeeping. So thank you for attending today. We have a ton of NNLM webinars going on today, so thanks for deciding to spend your hour with us. And as a reminder, today's presentation was recorded and will be posted on the NNLM YouTube page as soon as possible. That usually occurs within a week. And once that is available, I will email everyone who pre-registered for today's webinar a link to the recording, as well as send a copy of the presentation slides and that resource guide. So to evaluate today's webinar and to receive MLA CE credit, you can visit the link on this slide. I'm also putting it in the chat box now, and you will also see it in that follow-up email when it comes to you. So once you have completed the evaluation, you will receive instructions on how to claim MLA CE credit through the MedLibEd website. So thank you everyone for today's webinar, and thank you so much to Roy and Allison for your time and insight. I'll hang out for a few more minutes in case anyone has any more questions, but I hope everyone has a great afternoon.
Yeah, have a good day.